It hasn't been very well described yet, and I think that there remains a bit of uncertainty about what exactly it is. The first one that we heard of, I think at least regionally, was maybe out of Oregon. And then there's some in the Northeast as well. This seems to be, by all accounts, to be one of this kind of complex, what's called canine infectious respiratory disease, which is, a lot of people would call it, or kennel cough, for example, is one version of this. And so we'd be looking for things like coughing, sneezing. Sometimes there's some ocular discharge and kind of squinting, things like that. Generally, these dogs are lethargic and off of their food. They kind of don't want to perform. They don't want to go for the normal run or a walk that they normally would do. But certainly the coughing, sneezing, kind of hacking thing would be the principal clinical signs that owners should be looking for. There are some tests that we submit that will help to definitively diagnose that, specifically or especially once we know what to be looking for. As it stands now, the testing that is routinely done is kind of more of a broadcast type of test that looks for a number of different pathogens. We have had, over the many years, there have been flare-ups of what is generally considered or generally called kennel cough, and at that point it's always a good idea to stay away from the boarding facilities and the common dog parks and that kind of a thing. But I guess it maybe would be premature to say that they shouldn't, clients shouldn't be taking their animals there, particularly when they need to be traveling and things like that. I mean, we might get into a pinch point with that, but as it stands now, it hasn't seemed to be. Don't seem to be observing anything that would suggest that we're on that much of a ramp up of the incidence of this respiratory disease. But certainly, on the other hand, the other side of that is certainly if a dog is displaying any of those clinical signs, the coughing or the sneezing or inappetence or those kind of things, then I think it's really certainly responsible for them to not take them to the boarding facilities and not take them to the playgrounds and the dog parks or to the family visits and things like that. If any of those dogs are displaying any of those clinical signs, then I think it'd be really important to make sure that those dogs are isolated and not taken to those, and then probably taken to their veterinarian so they can get evaluated.